Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Kelly Gibo, an infectious diseases doctor at Johns Hopkins, who has been triaging COVID-19 patients outside the hospital for more than a year. She talks about the dedication of her medical team and the sometimes difficult interactions with patients who don't believe they really have the virus. Let's listen.
Kelly Gibo, thanks so much for joining me.
Thank you for having me. I'm looking forward to their conversation.
So you are an infectious disease doctor at Johns Hopkins, and your role has dramatically changed over the course of COVID. Paint a picture for our listeners about the work that you guys have been doing.
So I have done a number of things with COVID over the past year and a half. I originally was at NIH working on some projects with NIH, looking at COVID in much larger populations of patients. And now I'm back at Johns Hopkins working on a trial looking at the use of convalescent plasma, which is the liquid part of blood, to see if it's helpful in trying to prevent complications from people who have outpatient COVID infection. So looking at people who are not in the hospital, but actually out in the community. So I've had the opportunity to interact with people who have been recently diagnosed with COVID over the past year and a half. Actually many hundreds of them, and have been able to follow them clinically, and have also treated patients on the inpatient service who have COVID infection as well.
Mm-hmm. Now, I understand that you and others are, you're working basically outside in a tent. Talk me through that.
So our trial is being conducted outside. We have patients who have newly diagnosed COVID infection. Many healthcare facilities don't want to bring them in because we don't want to expose others to the COVID infection. So anybody who's been diagnosed is treated in what we call pods. So they're little mini trailers that we have under a big tent. And we've been seeing patients in those pods for the past year and a half through incredible weather conditions. The fall and the spring were quite nice, but we've had sleet and wind and rain, and we've had, the extreme temperatures with heat this summer. So I give a huge amount of credit to both our patients who have been incredibly generous in coming in despite feeling poorly, as well as to our staff who have been able to deliver care in trying weather circumstances. And it has been a real tremendous learning experience for me to see the dedication on both sides of that coin.
What has been the impact on you and the nurses? I mean, I understand that these aren't the happiest patients in the world. So could you talk me through that a little bit?
I think one of the things that's been most enlightening to me is having practiced HIV in the 90s, when HIV was a disease that not everybody was comfortable with and people didn't want to touch or were afraid of getting HIV from a variety of different behaviors. COVID was much the same. And so I have seen patients who have come in who have been so grateful to be seen and to be touched and to be examined and to be cared for because nobody else has wanted to care for them. They have felt like they've done televisits with healthcare providers and that they've been then told if they're really sick to go to the emergency room. And I think that the patients have appreciated actually having the opportunity to interact with a healthcare team in a physical situation. I've also been so very impressed at the dedication, bravery, and passion of our healthcare team who's been able to deliver care, especially early on when we didn't have vaccines and were unprotected. And so despite the fact that we had PPE, we didn't know the risk to our families and to others. And I've been so grateful for their amazing care to our patients, despite the weather conditions, despite being outside, despite being in a trailer, and sometimes, in really adverse circumstances, really bonding together to really just form an amazing healthcare system. It's been really inspiring.
But the work is not easy, and the patients are not easy either in many cases.
We have had incredibly grateful patients who have been very appreciative of the care we have given them. We've also had some patients who have suffered extreme loss. So many times families will have people who are in the hospital or have recently died as part of their COVID infection. and sometimes are experiencing profound grief. And we've also had people who've been incredibly angry or frustrated, both with the healthcare system as well as with COVID. And it's been interesting to see the reactions, across the spectrum. And despite this, our team has been incredibly generous and grateful in trying to provide good care. I think one of the things that has been hard is when sometimes people come in with misinformation about COVID, and whether it's regarding the vaccine or regarding how it's spread or regarding some particular health belief that they have about COVID. And when we've tried to explain other scientific principles, that they sometimes are very resistant. And despite that, we just continue to deliver good care. And we're really proud of that.
Mm-hmm. And I understand you've had frustrations, and your patients aren't always telling you the truth, though, are they?
So it's interesting. Especially early on, patients were incredibly grateful and very interested and appreciative. As we have called more and more patients who have tested positive for COVID to tell them about their results or to help them get engaged in other forms of care, there has been a lot more resistance, and people think that either it's fake news, that they don't actually have COVID and that it's not a real test. We've had people who have been very angry, saying that they were vaccinated and they don't understand why they are getting COVID. And we've also had patients who have continued to ignore some of the social isolations and guidelines for people who have COVID infection. And that's very frustrating when they have continued to go out into the community or go to work or do other things, despite the fact that they have COVID infection. And that's a real difficult situation, I think, for our teams to try to deliver good care when they've been doing that, and to people who are dedicating their lives to actually helping to come up with a solution for the pandemic.
Mm-hmm. People are lying to you, aren't they?
We have had some people who have lied, and that has been frustrating, no doubt. People, I think, initially early on were very concerned about how it appeared that, if they were engaging in things that they weren't supposed to do when they got COVID. And one of the things as a healthcare provider is I tell patients, there's no shame, no blame, right? It doesn't matter to me how you got COVID. What I want to make sure is that we don't share it beyond where we are. And I think that that's an important lesson is I don't really care where you got it. And I tell patients with other infectious diseases as well, right? There's no blame in having one. It doesn't help me to have you feel shame for it. It's everywhere. And just making sure that you don't spread it to others is really what I try to do.
Mm-hmm. And I think that's sort of an interesting thing is that there's not quite a full understanding of the shared risk that we all face.
And I think that's one of the most challenging parts of this is for someone to get on an airplane when they have COVID and thinking that they're only really affecting themselves when actually they're affecting potentially many others around them. Even if all the other people on that plane are vaccinated, they could potentially not be able to mount a response, or they could have cancer, or they could have somebody else at home who is at risk of getting COVID. And so getting onto an airplane when you have COVID or continuing to go to work when you have COVID exposes others. And that's really one of the things that's been challenging is it's no longer affecting just you. It's affecting many others who may or may not be able to protect themselves.
Mm-hmm. You guys sort of thought this might be coming to an end, and now Delta has changed everything.
So I think many of us were hoping that this was going to be, the vaccines were going to get us out of this very quickly. And really, we had huge hopes in the springtime that the vaccination rates were going up as the rates of COVID were going down. I think many people, particularly in June and July, were looking forward to a summer of fun and excitement, and myself included. And Delta really did change the equation in many ways, partly because it's impacting unvaccinated people in the South and in other populations. I think the other thing that's been hard is it seems to have really affected some of our immunocompromised patients. So we're seeing people who have organ transplants or HIV or chemotherapy who can't protect themselves even if they got the vaccine. And so those two things together have really been sobering and caused some of this real increase that we've seen in the past few months.
I guess personally, I feel frustrated with those who haven't been vaccinated. I hear people who say, well, we shouldn't treat the patients who haven't been vaccinated because we don't have enough room for everybody. Tell me about that calculus.
So thankfully here in Maryland, we haven't had that situation yet. I do know that there are places that are currently overwhelmed. And it is frustrating to healthcare workers when we see people who aren't vaccinated, yet we provide good care, right? Our job is to be healthcare providers and to not blame anybody for the situation that they may or may not be in. And we don't blame people who smoke or people who don't wear a seatbelt or people who aren't wearing a helmet. We take care of everybody when they come in, within the resources we have. We also are humans. And so we do get tired, right? We are tired. We have felt that we have worked really hard over the past 18 months or longer. And, I think as a real emotion, many people are frustrated with trying to get people vaccinated or to fight fake news. So there are real reasons people are afraid of getting a vaccine. And I've tried to have respect for that. I think having a conversation with people to understand why they're afraid of the vaccine is important. And is it because of a concern about reproductive health? Is it a concern because they don't think it's going to work? Is it a concern because they want to see the FDA approve it? So understanding what their issues are is something I think as providers, we can spend a lot of time doing. One of the other things I think is very helpful is sometimes having voices that patients trust. And whether it's me as a healthcare provider or their religious leader or an athlete or a singer who helps with somebody that they trust as a reasonable person. So we've tried to get others to help with vocalizing why they've been vaccinated. I think that's really useful.
Although there are some out there who are giving the opposite messages, right? The influencers who are saying, don't get vaccinated. So that's counterproductive.
Absolutely. At least from my perspective. So I feel that, what we would like to do is promote health and well-being, and vaccines are part of that. And so doing everything we can to try to help that. It is very frustrating when there are voices out there often presenting misinformation that is very convincing and it is affecting people's behavior. And we saw this early on in the pandemic where people were trying therapies that potentially were actually harmful. We're seeing it now with ivermectin and people being encouraged to take ivermectin by some of these influencers, and it's been shown to not be effective. And I think that that's really a problem for the trusted voices of healthcare versus the people who aren't necessarily presenting as much scientific information.
Absolutely. This makes me think there must be some burnout and turnover. How are you all coping?
It's a great question. We're tired. I'll be honest, I'm tired. And I think many of us, we're hoping to go on vacations and celebrate accomplishments and so, many of the anniversaries and birthdays that we missed the previous year. And yet here we are facing another winter with increasing numbers, and it's demoralizing to our teams. We have had a huge number of our nurses leave. We've had a huge number of our healthcare workers, taking other positions or switching. And I think that different organizations have tried very hard to help with healthcare worker burnout. But we're tired. We're frustrated with, facing the same things day after day. We all want to go see our families. We all want to resume normal life. And so trying to get us back into that is going to be helpful. I am concerned about our healthcare staff and how we can try to help them with potentially facing another surge if it happens here in Maryland with, the concomitant mental health burden that goes along with that. It is difficult to see people die. It is difficult to fight people to get vaccines. Not fight, but it's difficult to hear mistruths. And, it's difficult when you are personally attacked for presenting what you think is healthy information. And I think that that's one of the things that is most burdensome to our teammates is when they're presenting medically correct information and are attacked as being part of the government, or you're just voicing something that you've been told to say. And really, I think most of us feel that these vaccines actually are really effective.
Mm-hmm. Are we going to be able to vaccinate ourselves out of this? Or are you worried about, I just heard about another variant called Mu.
Until the whole globe is vaccinated, we're going to continue to develop variants. And so this is not a 6 to 18 month sort of proposition. This is going to be a multi-year, I think, adventure. And we need to get the healthcare system able to deal with it. So we need to be able to resume as much normal life as possible, getting our kids educated, getting people back into the workforce in a safe way. And so trying to have us accommodate that in ways that reduces the risk of COVID infection and most importantly, keeps people healthy. So you could get COVID infection, but stay home with flu-like symptoms for a few days. I'm okay with that. What I'm trying to avoid is overloading the hospitals and high risks of morbidity and mortality. And so until we have people vaccinated and there's enough herd immunity, these surges are going to continue to happen as these variants sort of develop. And I think that that's one of the things that is of most interest to infectious disease and others is trying to get as many people vaccinated as possible to try to reduce the risks and burden of the serious COVID infections.
Mm-hmm. I guess one thing that I think about a lot is I know that not in Maryland yet, but in a lot of places, the hospitals are full. What if one of my parents had a heart attack, God forbid? How would they be treated?
This is certainly an issue where people are having to put off routine and other urgent medical care when hospitals are overburdened. And we saw this in Maryland and in other places last year when we had to put off some routine care. We're now trying to get people back in for routine care when it can be accommodated. But in situations where hospitals are overwhelmed, people are unable to get routine care or some of the urgent care they've needed. So surgeries have been postponed. Other types of medical visits have had to be postponed. And that's really detrimental to the general population. So I hear you and know that the healthcare teams are doing their best to try to accommodate as many people as possible. But it's incredibly frustrating, both to the healthcare teams and to the patients that they're trying to serve.
Kelly Gibo, thanks for all that you've been doing, you and your team, and thank you much for joining me.
Thank you very much for having me. It's been a pleasure. We really appreciate the opportunity to be here today.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.